Hello, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to take some questions that you may have about your cat's vaccinations. And I have an assistant here with me that's going to ask me some of those questions about how to understand more about cat vaccinations.
So, first question, are cat vaccinations necessary?
Yes. So cat vaccinations are necessary. Cats are exposed to all kinds of viral infections. We can prevent them, and they are incredibly helpful and life-changing for cats that receive them, and also cats that don't potentially will end up with these diseases.
What cat vaccinations are typically recommended, and what are they for?
So the most common cat vaccines that are recommended would be the FVRCP. So that stands for feline viral rhinotracheitis, calici, and panleukopenia. So we call that our FVRCP or our upper respiratory. It goes by both. Of course, rabies vaccines for cats. We also have a vaccine that we recommend called our feline FLV or feline leukemia vaccine. And then rarely we see vaccines on the market for FIP, which is feline infectious peritonitis. And there's also one that's been labeled for FIV, which is feline immunodeficiency virus. Those are on the market.
So what's the vaccination schedule for the 3 life cycles of a cat?
So the 3 life cycles are kitten, adult, and senior. So the lifestyle of your cat is going to obviously determine what type of vaccines that we're going to recommend. So when a kitten comes in, we are always going to recommend that they get an FVRCP or upper respiratory. They're going to also get a rabies vaccine, and because they're kittens, we're going to recommend that they get a feline leukemia vaccine. So these are all recommended by our Academy of Feline Practitioners, and these are the core kitten vaccines. As your cat ages into an adult, we're going to determine what lifestyle they have. So the most common adult vaccines that are given to the vast majority of our indoor cats is an FVRCP and rabies, and they're going to get those every 3 years. We're going to want to see them every year for a good checkup, but their vaccines are going to be depending on their lifestyle. If your cat does go outside, we're going to often add in that feline leukemia. The FIP and FIV vaccines are not core vaccines, nor are they recommended.
And then senior cats.
Oh yeah, senior cats, sorry. Senior cats, we're still going to protect them. We consider them as adult cats. Again, it's their lifestyle dependent. Again, because they're seniors does not mean that they don't get vaccinated, but if they start developing some medical conditions and we do start to determine if they're still candidates for vaccinations, we may start reducing their vaccines. But vaccines are still incredibly important. They're going to prevent disease, and we don't want our senior cats getting diseases that we can prevent, so vaccines are still important.
Are there risks or side effects associated with cat vaccinations?
So the answer is yes. There's always risk with medical interventions. The benefits for vaccines far outweigh the risks, but some of the risks would be if your cat has an a hypersensitivity to that vaccine, like an allergic reaction. We don't necessarily know that your cat's going to have that reaction, so that's a risk that we would have you watch for. So what are the symptoms of a cat vaccine hypersensitivity? They're going to be maybe some hives that can develop on the skin, or they can have some GI side effects like vomiting or diarrhea. These are usually acute. They're usually seen within the first 30 minutes after vaccination. Rarely we'll see a delayed response, which could be in the first 24 hours. We can see tiredness or malaise. So just like when you and I get a vaccine, we can maybe feel tired because our immune systems are being stimulated, and that causes fatigue, so tiredness. Sometimes soreness at the site of the vaccine, right? Because we put a needle, inject a vaccine, so we can have tenderness at the site of vaccination. The most serious side effect to any type of injectable or vaccine would be a vaccine site or an injection site sarcoma. It's incredibly rare. I think the statistic is 1 out of 100,000 injections. It's a adverse reaction to whatever is in that injection, and the cat has an innate ability to cause a cancer to form called a sarcoma. It's incredibly rare. It is incredibly serious when we diagnose it, but we do have those conversations. If you have questions about risks of vaccination, we want you to ask those, and we want to go through it and make sure it's the right thing for your cat.
If my cat's going to live indoors, do they still need to be vaccinated?
Yes, so cats that live indoors are still recommended to have protective vaccinations. The recommendation is still upper respiratory, or the FVRCP, and rabies. We give those every 3 years because we know protective immunity lasts that long in our cats, and they are also labeled products for that long. Cats can still get exposed to upper respiratory pathogens. You're like, how can they have that happen when they're inside? Well, there's windows that can stay open and screens, and we have lanais and screened-in porches. Cats, cat-to-cat interactions, sneezing and respiratory pathogens can come through screens and air. We also know that the species that carry rabies, one of them is the bat. It would be rare, but bats can come in your home, and your cat is the predatory species that's going to go after that. These recommendations are based on risk, and we want to minimize the risk of these vaccine risks, but we also want to protect your cat, but we also want to reduce how often they're having them done. So again, indoor cats should be vaccinated. They also should see their veterinarian every single year. So if you have any questions about your cat's vaccinations, please ask your veterinarian or reach out here to Blue Oasis Pet Hospital. We're here to help.